Hi, John here for Total Health Magazine and Total Health Television. I'm sitting with Dr. Mimi Guarneri. Is that how I pronounce your name?
Yeah, perfect.
Guarneri.
Perfect.
Whom I just met this past weekend briefly because you were so busy.
Yeah, it was a busy weekend.
You are the person behind the Scripps. How would you describe it? It's the Scripps.
Well, we had a very large conference this weekend, which was Natural Supplements, an evidence-based approach, and I am one of the directors for that conference. This was our 13th year of teaching not only physicians, but all healthcare providers how to look at the evidence and use natural supplements in an evidence-based way.
Right, so we're talking about supplements as functional medicine. And there was so much science there. It was really exciting. I interviewed quite a few doctors that were just attending, were attending the lectures, and they were all of the same mind. They were like, wow, they couldn't wait to go back to their practice, and they can't wait to share it with their peers. And yes, it's
very exciting. It was really very exciting.
So how did it come to be, though? Like you say, 13th year.
Right.
How did it start? Like who was the force behind this?
In the 1990s, I was spending most of my time doing conventional cardiology, and at that time I was placing a lot of stents in the arteries, so I was really an interventional cardiologist. And then I began to do research with Dr. Dean Ornish on the program for reversing heart disease, which was about yoga and meditation, vegetarian diet, exercise, all the lifestyle change components. And as a card-carrying cardiologist, I was amazed to find that people got significantly better, that we had a 91% reduction in chest pain, that people were decreasing their weight, they were hitting their cholesterol and hemoglobin A1C goals. And this was all through the power of lifestyle change. So that really propelled Rowney King, who was our nurse at the time, and myself, to create the Scripps Center for Integrative Medicine, because it became very clear to me that Western medicine is great in acute care. If someone is having a heart attack or a stroke, you want to be getting the best of Western medicine. But Western medicine is really bad at preventing disease. We're just not taught that. And we're also very poor at chronic disease, how we handle chronic disease. We tend to train with what I like to call the ill to the pill thinking. So every ill you have, whether it's your knee or your heartburn, gets a different pill, forgetting that all your systems are working together. And so that really led to the formation of the concept of integrative medicine and holistic medicine, because holistic, treating the whole person, body, mind, emotions, and spirit, using all of the global healing modalities. So it may be acupuncture, it may be pharmaceuticals, it may be Tai Chi, it may be nutrition, you know, all of these things working together with one goal, restoring the person to the best health possible and the best quality of life. So we realized very quickly in the 90s that clinicians were not trained in this, that the training we received in medical school was not training about health, it was not training about nutrition, so we started the natural supplements. Dr. Robert Binakdar, myself, and Rowney King at the time started the Natural Supplements Conference so that we can bring to our colleagues, this is how it started. We want to stand up and say, we have a lot of evidence, and here's how to use it. And look at it objectively, like you would look at any science.
And how was that? Because I have to say, when I think about you 13 years ago, it's sort of like just this picture in mind. I remember walking into my program director's office in the 80s, and I said I wanted to do a talk show on family, on relationships. And he goes, you want to what? I said, well, Brian, you know, I've been meeting and talking to so many people about the way like they're not able to figure out how to keep their marriages together, their relationship. He goes, but John, you're an afternoon drive DJ. Why would you want to do a talk show? I said, why not? Somebody has to ask the questions.
And it's important. it's important. Integral to health, right?
So I just was picturing you when I thought of that in somebody's office saying, would like to do you want to what? So was it, obviously it was accepted.
Well, the first round, when we first went to the academic department, they said, we're not going to give you continuing medical education units. We don't think anybody would come. So they basically didn't really want to allow us to do it.
Right.
So we got another institution to sponsor it, and we did it, and we were a fledgling, and 150 people showed up.
Right.
And the next year, 300 people showed up.
Right.
And then 400 people, and this weekend over 500 people showed up. And it was just a statement that the clinicians were saying, we want to be educated
Right.
here. Right? So, in Western medicine, we're so good at taking the science of disease and translating that into practice. Right? So we say, oh, this stent has a lower restenosis rate, therefore we'll use this stent. Well, when a study comes out that shows you can prevent diabetes through exercise and nutrition, we should be all over that as well.
Right.
Or when a study comes out and shows that acupuncture may be good for osteoarthritis, we should be doing that. Or
Right.
in the supplement world, that omega-3s will lower triglycerides, or niacin will raise good cholesterol. So we should be looking at the data and using the best, right? And not just picking one side of the equation. Does that make sense?
Oh, it does. I interviewed several of the doctors and the researchers behind some of the supplement science. One of them in particular just jumps off me because they tested me was Canada RNA, and they had a product or a medicinal component called they told me how to pronounce it two ways. They should have left it at one because my brain wants to pronounce it both ways at the same time.
Okay.
Baloki. And it was it was based on an earthworm that has been used in Chinese medicine for thousands of years, but the Japanese decided to test it, so they took it into clinical trial, stage 1, stage 2, and stage 3, if my memory serves me correctly, and proved that, hey, wait a minute, this stuff actually works. And so now this company is bringing it, or has brought it to the market to doctors and clinicians in the U.S., and they had there must be, I think I saw approximately 30 studies on it. Mm-hmm. And one of them was how it compared to Wayfarin. Mm-hmm. And it was almost identical in performance to Wayfarin, but there were no side effects versus the Wayfarin.
Well, I think you have to look at every study through an objective lens.
Of course, I was just picking that one.
And everything has to be, this is exactly though why we created the conference, because we said, if there's evidence out there, let's put it up, let's talk about it, let's bring it to our colleagues, let's have our colleagues, review the data and bring the best forward so that we can make more evidence-based decisions about some of these things.
Okay.
And that's, so we had what I would consider some of the finest, if not the best speakers in the world talking about natural supplements this past weekend. And there are people that are just extraordinary in their field, people that are extraordinary in biochemistry.
Yes.
And really giving pearls to all of our students.
Yes.
So that they're not esoteric things, but things that they can take home tomorrow and put into practice.
Right.
Right? This is the data on the Mediterranean diet. This is the data this is the way to think about Hashimoto's thyroiditis.
Oh, I heard
all of these
so
things,
much
right?
about the thyroid talk.
Oh,
and
it's a great talk.
Dr. John Kaiser's talk on mitochondria. Wow, it was.
They were one right
They were.
after the other, great
One after the other.
talks. And I have been doing this for years and years, so I've heard every talk from
Yes.
this conference plus others. And no matter when you go, you always learn something. There's
Yes.
always something new, some cutting edge item, and
Yes.
gives you something to think about. And it also helps researchers to say, okay, let me take that further.
Right.
Let's take that concept and expand upon it,
Right.
and so on. I will say that when you look at the supplement industry, it's a big industry, right?
Yes.
And we have many, many supplements on the market. And anyone who's not playing fairly, and they're not making things to pharmaceutical grade, that are
Correct.
making
Yes,
claims
that's
that
important.
are not correct, that are
Yes.
so on, those people should be shut down and really just put in jail if that's where they belong. because they heard it for the people the companies that are doing really good, strong work.
Yes.
And good, strong science.
Yes.
Right? So,
Yes.
and that's what we want more of. And I do want to say that we have to remember as healthcare providers that supplements are supplement to lifestyle.
Yes.
Right?
Yes.
So for me, it's always, if someone has something going on, let's say diabetes, we say, what's going on in their soil? Why do they have this thing called diabetes? Is it because of the foods they're eating? Are they low on micronutrients like chromium, for example? Are they not exercising? Are they not sleeping well? Or do they have sleep apnea? Are they stressed out? Is this raising their blood sugar, their cortisol level? So for me, all of this is about looking at what's going on with the individual, the world that they live in,
Right.
the people they interact with, the foods that they eat, the air that they breathe, and so on. And then supplements become, you can almost think of it in two ways: foundational, what do we all sort of need? And then how do we use supplements and herbal products, for example, in a therapeutic way.
Correct.
Right?
Yes.
And so our goal, and my goal, through not only this conference, but through the Academy of Integrative Health and Medicine, is really to educate practitioners
Yes.
so that they have the data that they need to make the right choices for their patients.
Right. And so the physicians that are members of your academy, how are they certified as members? Do they?
So the Academy of Integrative Health and Medicine is a membership organization. It's a membership organization with a couple of core values. The core values are very simple. We believe prevention is the best intervention. We believe that you can use mechanical fixes when you need them, of course, but we want to focus on keeping people healthy and
Yes.
restoring health. We believe in treating the whole person, body, mind, emotions, and spirit. We believe in the interrelationship between the healthy humans and the health of the planet. We have a sick planet,
Yes, we do.
and that's a time for a whole other talk. But when you look at the simplest thing like air pollution causing heart disease and asthma and breathing problems, to lead in our water supply, to persistent organic pollutants in our soil, there's this dance between the health of the planet and human health, and we
Yes.
recognize that. So sustainability is important to us, not as an add-on, but really in everything that we do. And also we want to separate out get away from these silos. You know, you see a physician, you get one set of prescription, then you go to your acupuncturist, you get something else, and you go to your naturopathic doctor, you get something else, your chiropractor gives you something else, and no one is talking.
Correct.
So
yeah.
our goal is to have our patient in the center, the person that we serve, and
Yes.
that person is surrounded by all the practitioners that are working together.
Right.
Right? That it's a team. It's a multidisciplinary team that works together. And
Right.
that's really our goal in creating the Academy. And anyone can be a member. Lay people can be members. They can be affiliate partners. Organizations can be members. So we already have 34 organizations that say, hey, we stand with you. We agree with you. So the larger we become, I always say, united we stand,
Yes.
right? Divided we fall.
Absolutely.
You know, let's face it, we have to push healthcare to a tipping point
Yes.
where it just goes boom and it's done. You know, it's no longer called alternative medicine, integrative medicine. It's just good medicine. And it's about health.
It's interesting. I always wonder about where that term alternative medicine came from, because what you're talking about is medicine we've been practicing for thousands of years. And allopathic medicine has only been around since 1960. So really, which one is the alternative medicine?
Right, and I don't
So-
even, and I don't like these terms, quite
I know,
frankly.
I
I
don't
think
either.
if there's research, you just say, how do we get this person toward health? Let's look at what's out there that we can use.
Well, I like the
and-
term integrative medicine.
Yeah.
It's really integrative medicine, because food and supplements, food for functional medicine, is really what it is. So, I mean, if
Yeah.
you're eating canned food and processed food, well, don't expect to be healthy.
Right.
And actually, I had a great interview with Dr. Charles Benz, who was at the conference. He was the one who told me about the conference.
Okay.
And I interviewed, I think I spent at least 2 hours with him, getting different bits from him on
Right.
different topics. He's based in Florida, and his organization is Healthy at Work. And I actually bought his book. So usually I get books sent to me from, and we're going to talk about your book in the next segment, but usually I get books sent to me, but I loved his book so much, I bought his book, and I give it away sometimes.
That's great.
But because it's just a small little pocket guide, health pocket guide. You can put it in
Sure.
your purse, you can stick it, you can take it anywhere, leave it in the bathroom. And it's just it's a great starting point because he has so many pages of references to go to learn more. Right? Because there's just so much information out there.
Yeah, and I've been writing my second book, which should be out before this year ends, and I decided that I really wanted to do it in a way
Okay, hold that thought.
Okay.
We're going to do that in the next segment.
Okay, that's fine.
We're going to wrap this up then.
Okay.
So let's just wrap up this part then, which is really, again, it's really exciting. I just love this Scripps Center for Integrative Medicine that you've created, and the conference. So it's in its 13th year. Is it just that I believe there's 2 different types of conferences, isn't there, in the year?
Right. So the Scripps Center for Integrative Medicine I created in 1997 with Rowney King.
Right.
And the conference grew out of that. And then I went on to create a number of other centers, including the Chamber Center for Wellbeing in Morristown, New Jersey, and the center right here, which is my current center, Pacific Pearl La Jolla in downtown La Jolla.
I love the building.
Good. So do I. So the Academy, I think what you're getting at is I'm the director on the Academy Conference, which is called People, Planet, and Purpose, which is happening the last week in October at Paradise Point in San Diego.
Yes.
This is a week-long conference that covers everything from global healing traditions to sustainability to healthy communities to nutrition and mind-body medicine. It really is the best that you can think of about health. And then the Natural Supplements Conference is in January. In April, Rowney King and I chair another conference for Scripps, which is a integrative nursing conference, so that nurses can get the education in this area as well. Although anybody can come to any conference.
Right.
You don't have to have a particular title or degree.
Right.
I mean, I had many of my patients at the Natural Supplements Conference this weekend. They were going around and listening to lectures and, learning. And I think that's great.
Yeah, that's no barrier to entry. I loved it. It was great. It really was. So, all right, well, I want to thank you for this. We'll continue on in a moment. We'll do another segment.
Great.
But thank you very much for this, Mimi. Dr. Guarneri.
Perfect.
Thank you very much for your work and your effort and starting this whole thing with Scripps. It's the tip of the spear, the thin edge of the wedge, but I'm really, it gives me hope for the healthcare system.
It's happening.
It's happening. All right. I'm John. We're going to go back to the studio and stay tuned for The Heart Speaks.